Good afternoon, everyone. Welcome to our Health Equity Jam session, sponsored by the Johns Hopkins Center for Health Equity and co-sponsored by the Bloomberg American Health Initiative. So we are very excited about our first jam session of the calendar year, which, as you can see, will entail a very exciting panel of experts who can talk to us about the intersection of policy and research and what we can do to better promote health equity. Before we get started, we will actually have a brief welcome from our center director, Dr. Lisa Cooper, who will just briefly highlight the mission of our center and welcome you to today's event. So, Dr. Cooper.
Well, it's nice to have an applause before I've even done anything. So I'd just like to welcome all of you to this special Health Equity Jam session on behalf of the Center for Health Equity. The mission of our center is through leadership, research, and education to advance comprehensive community and health system strategies that will eliminate disparities in health and healthcare in our own community, domestically, as well as globally. And so we're just so excited to have this wonderful panel here today. We're excited to have all of you here. We're looking forward to a very interesting and engaging conversation among all of us. And we hope that you'll attend future sessions. So thank you.
So it's me again. I guess for those of you who are new to our Health Equity Jam sessions, I should tell you my name. So I am Tanjala Purnell. I'm an assistant professor here in the School of Public Health with a joint appointment in the School of Public Health. And I'm also the associate director for education and training at our center. And so if you haven't attended one of our jam sessions, you may not know that we have a non-traditional way of introducing our speakers. And our speakers for today have been kind enough to play along. And play along means they were kind enough to share a fun fact about themselves that you may not easily find by Googling their names. So they are each, prolific in their own rights. You can Google them and read pages and pages for hours at a time. So I'm not going to read 30-page CVs. So I will share the fun facts that they actually shared with me. So our first panelist, attorney Waverly Gordon, is working as health counsel for the Energy and Commerce Committee for the U.S. House of Representatives. And Waverly shared a fun fact. During her time as a law student at Duke University, she spent a semester abroad in Milan, Italy. During this time, she also visited Egypt, Spain, Switzerland, France, England, Scotland, Ireland, and Germany to visit me because I was in town to give a talk. So clearly that was a very productive semester for Waverly. And I will just throw in an additional fun fact, and that she and I went to school together when we were working on our master's degrees at The Ohio State University. So, and the additional fact that she shared is that she recently drove cross country with her dad for over 16 days. So clearly, Waverly is a traveler. So we thank you for stopping by here on your many travels around the world. So our next panelist, Dr. Josh Sharfstein, is the professor of the practice here at the Johns Hopkins Bloomberg School of Public Health and associate dean for public health practice and training, and also directs the Bloomberg Initiative. And Josh shared that he can juggle pretty much any three objects that he can pick up. So I don't know if we'll have time for a quick demo.
Demonstration.
Okay.
Ready?
Okay.
Cameras, please.
We have cameras. Impressive. And I didn't even give him a warning that we were going to ask for a demo. Hey, I'm scared of you. The other fun fact that I learned via Waverly and through Google, is that he was also a staffer for Congressman Henry Waxman, who at one time was also the chairman of the House Energy and Commerce Committee, which is the same committee that Waverly is now health counsel on. So our panelists are connected in more ways than one. Our third panelist is Dr. Rachel Thornton. Rachel is an assistant professor here in the School of Medicine. She's also the associate director for policy at our Center for Health Equity. And Rachel's fun fact is that when she was a high school junior, she lived in Barcelona as a school year abroad student and was paid a stipend to travel Europe as a member of the Barcelona Conservatory's Chamber Orchestra. So, I don't know, Rachel, you didn't bring your instrument to give us a demo today, right? No. So she also got permission from her teachers to miss 2 weeks of high school so she could go with the orchestra to Germany, and she received free lessons from one of the violin faculty members there, and she won a local violin competition. So I don't know, we have a pretty impressive group of panelists here, and wow, I'm impressed. So, and then our fourth panelist is Dr. Deidra Cruz. Deidra is an associate professor here in the School of Medicine, and she's also associate director for research development here at our Center for Health Equity. So, Deidra shared that she was a Girl Scout Gold Award recipient. So, this is the highest award in Girl Scouting. I was a Girl Scout, and I didn't even know that this award existed. So clearly, I wasn't on that level of knowledge. She also grew up doing a lot of camping with the Girl Scouts and also her family. And her Gold Award project with the Girl Scouts was a statewide high school-based recycling program that she led through her involvement as the president of the Virginia Student Council Association. So clearly she's always been interested in helping us to save the world, even before it became the most popular thing to do. So she is also an avid tennis player, and she plays in the local U.S. Tennis Association League. And in addition to this, she has played with two of our panelists. Can you guess which two? Guess. Okay, I heard Rachel.
Josh.
Okay, well, they're the Hopkins. They're the Hopkins because Waverly's traveling all over the place. Yeah, so Rachel, which she played a lot, and Josh, which she played in a match with medical students last year. But her best sport in high school was actually volleyball, where she received a scholarship offer to a Division III school. She elected to go to a Division I school, UVA, which she proudly claims, and she claims to have failed miserably at her attempt to walk into their team. So this crushed her hopes of being an Olympic volleyball player. But I think that she's bounced back. If you saw the recent Inside Hopkins announcement and the dome, and winning $250,000 to save the world, I think you're doing pretty well, right? So please join me in welcoming our panelists for today's discussion. So I've also asked our panelists if they would mind just sharing a quick 1-minute intro of themselves, and in particular just highlighting some of the roles that they've played that really intersect this whole idea of policy and research, and just how they, came to join us for today. So we'll start with Waverly.
Hello. Hi, I'm Waverly Gordon. I'm originally from South Carolina. As Tanjala mentioned, I work on Capitol Hill for the Energy and Commerce Committee. I started this path. I've been on the Hill for over 7 years. I actually was sitting where many of you are sitting. I was a master's student studying health services management and policy, took a policy course and decided this was the career I wanted, and I've sort of never looked back. I cover public health for the committee, so I cover the agencies NIH, CDC, ARC, ASPR, BARDA, and I also cover health disparities for the committee, so that's also my link to this issue. Happy to be with you all today. I'm looking forward to talking to you all.
Thank you.
Good afternoon. Can everybody hear me okay? All right. My voice doesn't usually sound like this, so I apologize. So I guess the question was about how our work is intersected with research and policy. And I guess that started for me when I first joined the faculty and was working with, at the time, Josh is chief epidemiologist in the city health department. And we decided we wanted to look at some ways that zoning policy in the city might impact health, and got quite involved in some city level policy making around zoning code reform. And then subsequent, I think that was sort of a springboard for ongoing involvement in health and all policies, less of a health policy focus, but more of a focus on understanding how health is impacted by policy decisions made outside of the health sector, which led to spending a year working for the U.S. Department of Housing and Urban Development as a White House Fellow during the Obama administration, and getting involved with work on a variety of initiatives and partnerships that were ongoing at the time with the Department of Health and Human Services, and helping to coordinate HUD's contributions to the National Prevention Strategy, which is sort of the prevention arm of the Affordable Care Act, or mandated through the prevention components of the Affordable Care Act. And then staying on at HUD once I got back on faculty here after that year, to serve as a health policy advisor of sorts, which I think was mostly a connector across staff that I had worked with on a variety of issues at HUD, and staff within the HHS, mostly in the policy and evaluation division there. And the work continues in a variety of ways, but I think that's for the rest of the discussion, so I'll stop there.
Thanks. So again, I'm Deidra Cruz, and I am the novice on this panel in this work. But I'm a nephrologist, and my sort of earliest kind of foray into advocacy work was. I guess it's been now 5 or 6 years, I was selected as an anniversary fellow with the National Academy of Medicine, which back then was the Institute of Medicine, before changing its name. And in the course of that 2-year fellowship, had an opportunity to get some training in sort of how biomedical research gets then translated into policy, with the National Academy of Medicine serving in an advisory role to a number of federal agencies. So that was kind of my first foray into even just understanding how the process sort of works as far as the development of policy. And then more recently, through my subspecialty organization, the American Society of Nephrology, I've been engaged in a lot of advocacy work around policies that impact people with kidney disease, and have worked with my organization to kind of engage with a number of policymakers, both certainly at the sort of the federal level, but also at the state level, to try to kind of move the agenda that we think is important for patients with kidney disease.
Thanks, and I'm Josh Sharfstein. Before I came to the school a few years ago, I worked as the health commissioner in Baltimore City, and then as the principal deputy commissioner for the FDA, and then as the health secretary in the state of Maryland. And one thing that I'd point out for all these jobs is, on the one hand, people were trying to, help us come up with good policy, and I probably met with 1,000 different groups or lobbyists, but at the same time, we were trying to get other people to do things. So I was health commissioner of Baltimore, and we were petitioning the Food and Drug Administration. When I was in Maryland, we were trying to get CMS to do things. So it's not quite like you're on one side or the other. I've even been on both sides of the Energy and Commerce Committee. I've been on the staff side writing questions for members of Congress to ask witnesses, and I've been on the witness side, which is sometimes not as much fun as being on the staff side, but I've learned about karma that way. So.
Wonderful. Well, thank you all for these introductions, and thank you to our attendees for actually following directions and submitting your questions beforehand. We were, Dr. Cooper and I were both impressed by by the questions that we received, and we attempted to arrange them in about 5 different overarching themes. And so for the next, I guess, roughly half hour, we would try to get through as many of the questions that we can so that we can leave a few minutes at the end, and we have the 2 mics on the side so that we can open it up to the audience for additional questions. But our 5 overarching themes from the questions that we received beforehand are: the first theme, identifying which policymaker to engage and also how to tailor your approach. The second theme, best practices for engaging with and communicating with policymakers. The third theme is best practices for giving a voice to individuals and communities impacted by health inequities. The fourth, opportunities to train public health professionals to do policy relevant work. And then finally, best practices for identifying gaps and also providing evidence that's needed for policy. So we're going to start with our first theme about best practices for identifying the right policymaker, and in particular, how to tailor your approach to best connect with that particular stakeholder. So I will invite, either Waverly or Josh to start us out, I guess, with your response to the first question, since I believe that question may be most relevant for your experiences. So either one of you.
Go ahead.
Want me to start? I think it varies. I think you take sort of like look at what assets you bring to the table when sort of looking at who you want to reach out to. Like, are you an expert in something? Do you know a specific area really well? Are you a constituent? Are you a member of some organization that member is very close to? And then I would target from there. I mean, if you're a constituent, like, your member represents you. So you should go meet with them and their staff on any topic that you want to talk about to try to engage them, because, they represent you the same way they represent everyone else in your area. The other thing to think about is sort of what their interests are. So I work for the Energy and Commerce Committee. If you're coming with a health issue, we cover most of domestic health, Medicare, Medicaid, CDC, NIH, such that like a lot of them know a lot about those areas and have interest in those areas. So finding hooks where they're focused in it. Maybe they have a special interest in HIV, or maybe they have a special interest in just coverage, like they believe everyone has a right to health care, and sort of tailoring what you want to talk to them about to sort of what they're focused in, and also tailoring it to what's sort of hot. So like everyone on the Hill now is talking about opioids, right? No matter what your topic is, I've heard people talk about maternal health talking about opioids, and infant mortality talking about, and you find like that niche to get them engaged. And then other members will be, so for example, the Tri-Caucus, they are our champions of health disparities. They represent basically the minority caucuses on the House and the Senate side. And like they're generally always interested. They're always looking for ideas. They're always looking for ways that Congress can do better. And sort of it's just a matter of building those relationships and trying to target, coming up with like your target audience based on what you bring to the table, is sort of what I would say.
Great. I'd point out that, I think that most people, when they think about finding a policymaker, their initial reaction is, who is the person that's making the decision? And let's go right to that person, and let's put pressure on that person. But there are other ways to think about it. You can think about people who have different roles, not just maybe the policy decision maker. And some of the other roles could be advocates for you. So you want to make sure you know who the decision maker is and how other people relate to them. But if there's a state issue, maybe the city health commissioner would be an advocate for you, and your ask is a little bit different. And if you think about Congress, there are really 3 functions that Congress has. One of them is to write laws, one of them is to fund, and the third one is what?
Uh-oh.
The big third one, and it's one that's on Waverly's mind a lot: oversight and investigations. And so let's say you want to move an issue, and maybe it's not quite there that people are going to decide exactly what you want. If you could get someone to investigate it, I think one of the things I learned on Capitol Hill is that there may be no more powerful position in government than as an attorney on the majority side of Energy and Commerce, because if they are basically using subpoena power, they can get any information. on any topic. So you find something that really bothers you, they can focus an enormous amount of attention on it. So you're not just thinking about who the decision maker is, but you're thinking about all the different ways to get at an issue, and you kind of, it's like a different dimension of it, and then you figure out, just like Waverly said, what interests them, what interests you, how you can make a connection. But it doesn't just have to be with that one person that you find who is making the final impact. You're building a case, and you're making it eventually much easier for whoever that person is to make the right decision.
I wanted to add just one comment to what Josh was just saying. So one of the successes we had in kind of the kidney disease space is just around the point you were making about the oversight in just making the cases. So kidney disease, for those that don't work in that area, is an enormously expensive condition to the public. While patients, for example, who have end-stage kidney disease make up only 1% of the kind of Medicare population, they account for 7% of what's actually the expenditures for Medicare, and to the tune of over $30 billion a year. And so for our subspecialty organizations and our subspecialty organization and others allies of ours, one of the things that we tried to push for was an investigation of this spending, particularly the mismatch between the spending on the care of patients with kidney disease relative to the investment in research in kidney disease. So getting back to how much is the NIH allocating to actually find ways for us to improve the care of patients with say, for example, early kidney disease, so that we can prevent people from developing kidney failure. And so that led to a Government Accountability Office report, really kind of diving into where there may be some areas that could be improved upon just by that came out of just our pushing for them to take a close look. So I do agree that there's a few different ways to go there.
And I didn't mean to imply that the minority staff weren't powerful too. I was only minority staff on Capitol Hill, but then you get close enough and you see subpoena power, and it's like the precious. Yeah. So it is an enormous amount of power if you can get it.
And they set the agenda, they set the topics
Yeah.
that you cover. Yeah, it's very true.
Yeah, and I guess along those lines, what are just tips or advice for engaging with these policymakers once you actually, decide who's the right person to try and connect with? So how do we, in particular, distribute our research findings in a way that is policy relevant and provides, some plan of action versus just sort of rambling about what's wrong with the world and what we think should happen? But how do we build our elevator speeches, and how do we really connect with that policy window to be relevant and timely and effective? So anyone can sort of start there.
So I guess I'll start. So I think the key thing to remember about members of Congress, the reason most of them run is to solve problems. Like, we may not like their opinions, their views, their solutions, but at the end of the day, they get up every day thinking they're going to save the world by being a member of Congress. And so when you talk to them, you have to talk from that frame. It's hard to sort of say, smaller things that sort of need these other things to happen, they need these other things to happen. If they're, if we're talking opioids, we want you to come with a solution to say, this is a problem, this is a solution, this is what would be the impact. So, and it may not be that you can sort of say, this treatment modality will work just, to be able to help this many people. It may be, we've realized that there's some disparity in access to care, and we need research on it. That becomes a solution that then a member can try to solve the problem. So I think sort of it's always think of that frame. Always remember you're competing against 50 million other issues. So in a given day, a member may be talking about health equity. They may be talking about transportation. They may be talking about privacy. It's a whole host of issues. So you want to sort of be as quick and succinct and sort of tell the story of how you're affecting people and how it improves them, their constituency, the state, be it a national problem, and sort of always keep that in mind as you're framing stuff to talk to people. Now, if you're talking to a staffer like me, I generally will have more time. It varies. I may be more engaged to be like, oh, you can send me your research articles. Members of Congress, they're probably not going to have time. There are some who can really dig into it. If you're on ENC and you focus on healthcare, you may have more time. But if you're on the transportation committee, most of the stuff you read about are probably transportation. And so you sort of have to keep that in mind as well.
If I could jump in, and I apologize, as Tanjala knows, I'm going to have to run out in a little bit. But three things. I think I completely agree with everything we've really just said. One is, I think you want to think about your relationship with a policymaker, not just a one-shot. You want to be able to have a relationship, and part of that means, I don't mean like palling around with them. I mean that you're available to them. You send them things, they ask you questions. A lot of people, I say, how did you get a job on Capitol Hill? And it's weird. I did a rotation at the Food and Drug Administration when I was a medical student, and then I stayed in touch with people that I'd met who worked on Congressman Waxman's staff for 5 years. Every time they had a question, on medicine, they would email me or call me, and I would get right back to them, no matter what I was doing. And I just, that's, when you're in those policy positions, you need answers right then. And so even now in my current job, I work with a lot of people who are in the public sector, state officials, federal officials. I know when they're calling me, I step out of meetings, I'm there for them, because that's really when they need the response. And that then gives them a chance if they say, who can I get for an idea on this, because we have an opportunity to do $10 million for something, then I hope, they'll call me and I can connect them to other people here. But a lot of times people think it's like all about the one thing you're asking for, and then the next time it'll be someone else. But think a little bit broader and develop a relationship. Number two, it's really important to be like stone cold accurate. You don't want to get a reputation for like bending the truth, even if it's like in a good cause. And I remember, when I started on Capitol Hill, my office was the conference room. It was a conference room, and people would come in and have meetings, and there I would be like in the corner, like pay no attention to the new guy in the corner. But I learned so much from watching the kind of Hill veterans have these meetings. And one time there was a really senior person who had just left the Clinton administration. I was there at the beginning of the George W. Bush administration, and he was asking Congressman Waxman to take a position on something, and this very sweet, someone I thought was the nicest person, staffer, looked at him and said, basically there's no way I'm going to put Congressman Waxman saying something that like that, because as that's not true. I'm never going to do that. And by even asking me again, you're really shredding your credibility with me. And there I am in the corner like, but I was able to say, people would say things like, I'd say, look, this is a great letter for him to sign on to. There's some inaccuracies about it, and so I have these suggestions for you. And they would say, it's fine, it's totally fine. Not everything has to be perfect. And does Congressman Waxman know that there's a closet right-winger working for him? And I want to talk to Henry myself, because I've been friends with him for a long time. And I learned to say, I'm happy. I didn't say, oh, no, don't call Congressman Waxman. I would say, I'm happy to figure out whether we can arrange a call, but let's just talk for a second how that's going to go. You're going to make your point. He's going to turn to me. I'm going to say it's wrong. You're going to have to admit that. And that sound you hear will be your credibility going out the window. So you decide, how you want to handle it. But it is really important to, you're available and you're always, you can take what you say to the bank. And then the third thing is, and this is something I definitely think is important because I've seen it go awry a lot. It's not just the person who makes the decision who makes it possible to make the decision. It's the environment that they're in. And for example, when I was at the Food and Drug Administration, I wanted to take a certain decision, but the USDA was objecting and the White House was objecting. And so now you're an advocate, you come to me and go, I want you to take this decision. And I go, look, I'm doing my best. And then you write a letter to the newspaper and say, there's an incompetent person because this happens, believe me. And it's like, well, fine, you can call me incompetent. I'm the one person on your side. So you have to think like, as you think about this, it's not just, will you make this decision, but what can I do to make it easier for you to make this decision? I think is a really good question to ask. And that can be things like, who would it help if you heard from? Would it help if the hospital weighed in? Would it help if there were letters or exposés or investigations in the paper? What makes it possible? Just like we think in public health, you want to make it easier for someone to make the right choice. That's the same concept for a policymaker. You want to make it easier for them. It's not just that they should be heroes and stick their neck way out on something that really isn't, from their perspective, right, or they're even able to do.
Awesome. Now, Rachel, you've done work from the implementation side and also with Baltimore City leaders and with HUD. So how is how have your experiences But those types of interactions differed from our traditional Congress policymaker interactions.
Yeah, so Josh made me think of one thing, which is around this idea of building relationships and ensuring that you're not sort of biting or cutting off your nose to spite your face in the context of making those relationships. So I can say in the local, and interestingly, having worked, not on the legislative side, but in the executive branch, where people are figuring out how to implement new regulations and laws and what the wording should be and how they should be operationalized. And how they should be fed down to, states and municipalities. Everyone's always talking about the importance of working at the local level. And I was like, I actually did that. That's kind of nice. I think it's interesting how sometimes we can get particularly fixated on the federal legislative process, and there's so many other components and ways to engage that are sometimes really helpful to federal officials who are tasked with kind of implementing policies and regulations and making them real and practical for local jurisdictions. And so I think it is helpful to have some perspective on what that local process looks like. In the case of our work on zoning, I can say that when we first got interested in identifying connections between urban planning policy and zoning code reform specifically and health, it was very it was initially challenging to engage with the planning department because it seemed as if we were, in some sense, kind of hijacking the process from the very important policy goals at the fore, which were economic development, improving quality of life, harmonizing what's actually on the ground in Baltimore with what the code says should be there. And so that relationship building process, that process of saying, no, we're really here to help. We want to learn from you. We want to understand what your goals are and where there's overlap, as opposed to coming across as kind of adversaries in the context of a process that was already prickly enough on its own in terms of trying to get all of the different constituencies who might be interested in what the zoning code looks like, the architects, the developers, the neighborhood associations. And so taking the time to understand what the challenges are to a process, I think, can help you position yourself to be an advocate for what you think is important, or what the data or research is telling you is important, while also identifying ways that you can be supportive of the process and not sort of undermine the process.
That's such good advice. And people should know what Rachel was able to do to move Baltimore City from not thinking about health, Rachel and her colleagues, to move Baltimore City from really having not a scintilla of health thinking into their usual planning to really doing some creative and nation-leading things with that regard. Was really impressive, and I know when you got started, I was like, "That's a great project. Good luck with that." Yeah, I was like, that is but it is that process, and I think it also speaks, first of all, to sticking to your guns where it's really important, but to being able to learn about how the process works, and also to a certain amount of civility. Right. I don't know, and I mean that really seriously in Congress, and at least when I was there a decade ago, you could have just really very sharp political disagreements, and the members did, but then on another issue, they would be on the same side. And you'd learn, one of the skills you learned is even when you're disagreeing with people, you could wind up coming to them and being in alignment and being able to work with them on another issue. And, that can be hard sometimes because, especially on the issues that, really grab you, it's really, really hard. And it may not be possible in every case, but wherever possible, that's something to be able to do. That doesn't mean you pull your punches when you're talking about it, but it means how it's, I'm sure there are people who initially were quite resistant, and maybe you won them over, maybe in the end they still voted against it, but I don't know if you could talk to that a little, Rachel.
Well, I can say so it was a little different in the sense that the executive branch, so to speak, the departments under the mayor's leadership were, the planning department in particular was charged with the process of developing the new zoning code, the new ordinance that would then go before the city council. And so step one was identifying like sort of natural allies within the planning department, and then identifying ways to bring people closer to us who were concerned about the role of health in sort of in overtaking the process. So we built upon those relationships mostly with folks who worked in the research division within planning, who sort of had a natural inclination to get what we were talking about, whether it was around healthy food access or something else. And we persistently and respectfully engaged with others in the process who were very worried about passage, regardless of health being a consideration. And we decided in our report that we would take a tiered approach and highlight all of the good things that were sort of already on the agenda, that with unbeknownst to the planning department, we're going to have this potentially awesome impact on health, So we pulled out those things and sort of like, congratulations, by expanding the number of zoning districts where urban gardens are allowed, you're likely going to increase healthy food access in Baltimore, right? Like, so all the things they were doing for another good reason. And then the second tier was, it's great that you're going to have landscaping standards. If those standards could potentially incorporate, crime prevention through environmental design, or, greenscaping strategies to make sure that these public spaces are greener, that could be good for health, And then the third was, okay, we're kind of sticking our necks out here. We know this wasn't on your agenda, but the evidence is so strong that alcohol outlet density and proximity is associated with crime across the country. Every study, longitudinal studies, cross-sectional studies, there may be some opportunities within the zoning code to address liquor store alcohol outlet density in Baltimore, with no expectation necessarily that the city was going to say, hey, yeah, let's do that. That sounds really not risky and a good idea. But because there were so many other things, it was interesting to watch the staff from the planning department in their public hearings. By the end, they were like, and there's a lot of things in this new zoning code that could be really good for health in Baltimore. And so just that evolution through kind of patience and engagement. And they asked us for things. They asked us to estimate what the reduction in crime might be if a certain proportion of alcohol outlets were eliminated. They asked us to replicate a study that was done in Washington, D.C. to prove that what was true elsewhere was true in Baltimore. This idea that it had to be locally grounded was really important. And then we had to know when it was time for researchers to kind of disappear and let the process take place among the constituencies who actually are living on the ground the experience. And I think that may be a little bit of a difference maybe between local policymaking processes and the role of experts in national conversations around policies, but the local dynamics between institutions and communities were such that it didn't really make a lot of sense for us to be the people testifying to the city council and think that that was necessarily going to be good for the future of the legislation that we were interested in providing evidence to support. And yet we were still able to work with the city. And we were able to engage the media and help the city with understanding the messaging and the evidence base for some of the recommendations or why some of the existing strategies in the zoning code could be beneficial. So so I think it's being patient and taking time to get to know your local environment or the environment in a particular legislator's office or the environment within a particular part of a department, whether that you're collaborating and working with, and being available to them. And I think at the federal level, I know working at HUD, like economists and housing policy researchers are often tapped to to speak and weigh in on policy decisions that are underway. And it's important to maintain those lines of communication and to be responsive. So I'll stop there.
And I know that Josh has to leave to teach a course. So we're going to come back to theme 3 about giving voice to the community. And we're going to jump straight to opportunities to train public health professionals. So in particular, I want to know, you've all been where many of those in the audience have been as students. And I guess really what these questions, the overarching theme is, what courses should we be taking now, or how can we best prepare to do policy relevant work? Are there courses here in the School of Public Health? Were there other opportunities for training outside of academia? Or are there certain skill sets that are more beneficial for doing policy relevant work? Just, I guess, weigh in with your thoughts about where we need to be focusing our efforts, even if people are primarily epidemiologists or other researchers. What key skills do they need to be picking up now to do this type of work?
Sure. I would say that maybe a lot of the teaching on policy is what's the right policy. But what we're talking about is a little different, which is how do you get the right policy? And I think I'm going to be teaching the public health policy course in the summer. And we're sort of shifting a little bit to be a little bit more, not just what's the right policy, which we also want to do, but how do you get the right policy? And there are courses, there are certainly courses that go right at questions like advocacy. There are a couple really good advocacy courses. Then there are policy courses and that bridge a little bit both what's the right policy and what are the dynamics and who's responsible and how could you change it a little bit in there too. And so it's worth exploring the syllabus, particularly for courses. But I think my bigger point would be that it's not just the course part of the curricula that's really important for this. And I think, when I was a medical student, I got involved in different policy-related activities. When I was a resident, I was a pediatrics resident, and we saw that housing was the #1 health threat to the kids that we were taking care of. And we did we wrote a report about that, and we did a press conference with then U.S. Senator John Kerry, as residents. And we heard on the radio, the Boston Medical Center report, and we were like, wow, that was just the residents writing stuff down. I think, there certainly in medicine, at least, there's a little bit of this expectation that you have to wait until you're all the way at the top of the pyramid before you start moving into policy. But the rest of the world sees, students as frontline healthcare workers, and I don't just mean medical students, nursing students, public health students. And so I think there are ways to get involved in the issues that you care about and doing them through, practica or capstones or other types of educational opportunities. And you want to, I think, there are many, the last thing I would say is that there are many different ways to have an impact on policy. And a lot of times students come into my office. If you spent time with me, you'd see that I sit in my chair and there's a chair and there could be a movie of people just sitting in the chair and looking at me and going how can I have the greatest impact possible? So many people ask me that question, and it's because they're great, they want to have a great impact. And we all see these horrible problems and injustices. And I think, the point I would make here is that there are lots of ways to have an impact. You can do research on a problem and create a whole new path, a way for people to think about it. You can be a really strong advocate and be effective. You can sue people. You can, write. Yeah, there are all kinds of ways. And the right question isn't, I think, which is the most effective, because you get examples all along the continuum. The right question is, what do you want to do and what do you love to do? And I think it's really important in school to be trying on different roles and see what you like. I thought where Waverly said, maybe you could speak to this. What was it about the policy course that really, or the policy work that kind of turned the light on when you were a graduate student? But I think that it's, try to write a letter to the editor. If that feels weird, then, you learn something. Or, a research-related project, and you try on different roles. I learned that I really like the intersection of policy and politics. I wound up, a political appointee. I'm not that deep on the policy side, but nor am I someone who is direct action. I just I did a little of that, and I was like, I just don't think I'm that good at it, And nobody followed my chants. I would chant, nobody would follow the chant. But then I write an article, and suddenly, all kinds of things happen. So you sort of figure that out, and then you have confidence because it's what you want to do. I don't know if that is getting to the question, but I think school is a chance to try on these different things and figure out an avenue that you're really comfortable with and you're excited to work on.
Absolutely. And I should also add to the question, what unique skill sets do we need specifically to advocate for health equity? And are there opportunities around? If not, here's also a plug. So, as I mentioned, Rachel is the Associate Director for Policy at our Center for Health Equity. I am the Associate Director for Education and Training. Rachel and I have plans to put our heads together to think about gaps in our current curriculum and opportunities that we can provide to trainees and scholars. So think about this question as well. If there are particular opportunities or ideas about policy relevant training that you think will be beneficial from a health equity standpoint, the center's email address, which was on the RSVP and email, shoot us an email, let us know what you think, what your thoughts are, and we can see to what extent that kind of fits into our overall plan.
And as I'm walking out, just say, the Bloomberg American Health Initiative is very interested in supporting that kind of training. We've supported a course that Tanjala and Lisa have taught. We appreciate all of Lisa's great leadership on equity to the initiative, and it's one of the main goals we have. So there's support to start other courses. So we'd love to support more in that area. So thank you.
Yes, sir.
One question before Josh and the rest of the panel. So I know that this discussion is all about how to push your favorite policy forward. I'm sure you previously had sessions on what evidence do you need to formulate your policy. So could we talk about evidence for just 2 minutes?
Of course, yeah, that's theme 5, but we can jump there before Josh leaves.
Yes.
So one-liner, you gotta have it.
Yeah. Well, I think that it probably gets back to what I said about being really accurate and knowing things. That, there are a few tools in the toolbox. Stories are a tool in the toolbox. Data is a tool in the toolbox. If you're talking about particular policies, it's going to be much more persuasive if you can talk about the reason why you think they're going to work. Now, at the same time, there are policy opportunities which you may not have all the data that you possibly want, and so you have to make a case for why you think the data that's there is sufficient. But I do think that it's certainly something that people can rely on. I'll just say, when I was when I was working for the committee, I didn't put MD at the end of my name because I didn't want. It was confusing sometimes if I was writing people if they thought that I was an expert in the area, because a lot of the doctors who were consulted were experts. People weigh in, they're really experts, people really listen to them on the data, and I was getting confused. Was I the political staffer, or was I an expert? I think you can engage in both ways, but if you're coming in as the expert, then your authority comes from the fact that you understand the data, you can talk really accurately, you can say what's possible, you can give recommendations that are thoughtful, and I think that's a great role to play.
Awesome. Well, thank you, Josh, for joining us.
Okay.
And so let's continue the conversation about skill sets, ways to get those skill sets specifically for advocating for health equity, and also thinking about filling in the gap, the evidence gap. So anyone can.
I'll make a brief comment about kind of the sort of how to get started. I think for particularly for the students and other people who are kind of earlier in your career, I think it's what I found it to be important to do is just to know the policies that are relevant to your area of study. So I think kind of tracking that, and in many cases there are many other policies probably relevant, but starting with the ones that are pretty clear. If it's a particular chronic condition that you're studying, knowing how does that get, how do people with that condition kind of get that cared for? What is the cost associated with it? Kind of having a good handle on that, I think, is important. And then to the point that was made earlier about kind of the evidence, one of the, I think, early ways to contribute to this type of work is to actually study the impact of policies on the health condition or the issue that your area of focus is addressing. Looking at both the human and the other costs sort of associated with that condition. I think that's one way to kind of have that can serve as an entry point into learning more about policy.
So I would say, as far, I guess, Josh's point about what got me interested in policy. So I went to grad school to run hospitals. What my program was focused on. We had this random policy course that everyone had to take because it was part of the core. Tanjala took it too. Everyone else hated it, and I was like, man, this is like the best thing ever. Because it's, and I think it's sort of like knowing yourself. What do you find gratifying? Like certain people find gratifying sitting at a bench, 8-10 hours a day, moving around stuff in a petri dish, and that does it for them, and we need those people. Other people want to be in a room talking to people. Some people want to be in a court arguing with people, some people want to see patients. But I think it's sort of figuring out, this is what you're going to do for the next 30, 40 years. Although they say people in our generation are going to have multiple careers, but sort of figuring out through your coursework, what you're interested in, what would you do if you could do it for free? I know people always say it, but it really is true. Most days, not all days, most days I leave work and say, man, I got to do that. I couldn't imagine doing anything else. And so that's sort of, I think, what school allows you to do is explore different things, talk to different people. People love talking about themselves. So asking people to coffee or, to find out why they're doing what they're doing. Most people are very passionate and love what they do and feel they're doing exactly what they should be doing, and you should be doing it too. And so I think that's sort of an opportunity. I also put in a plug just really quickly. I think participating in student organizations, I think it is by far, for me, the most important thing and critical thing I probably did as a student. And I was a student for a very long time, at very different levels, just because it allows you to understand how people work. And at the end of the day, we're all just people. Be it you're the president, you're a member of Congress, your staff. We're all people trying to convince people of our message, what we believe in, what we want to do. We're negotiating. And that's what you do in student organizations, except you're not paying those people. Those people don't have, different, so you really get to sort of understand, the mechanics of getting people to agree with you, making people feel heard. That's a lot, that's a lot of your job in policy, trying to be heard. And so that's sort of another plug to sort of think about beyond just being here as a student, sort of, how can you engage in different ways? And as sort of Josh said earlier, those things also help you get out there and do policy and understand how people advocate for different things and things like that.
And I know you did a fellowship too, right? So did you want to mention that right after law school?
Yeah, so I was I did two things. So in grad school, in addition to sort of taking that policy course, my student organization would come to the Hill and advocate for issues related to grad students. And I was like, man, this is awesome. Because before that, I knew Congress existed, but I didn't realize there were people. Do you all realize there were people like me who work behind members of Congress and help write policy and help inform the policymaking process? I just never thought about it. And so then from there in law school, I also did an internship on the Hill. So I worked for Congressman Clobber when he was the whip. And then I came back when I finished law school and did a fellowship. And I got to sort of rotate with two members. One actually was one of probably the biggest health equity champion we ever had in Congress, Congresswoman Donna Christensen. And to Josh's point about what is to be in health, I think it was your question, what do you need to be a health equity champion? Mm-hmm. Patience, a lot of patience. You need commitment. It's not always a sexy issue. It's not always the issue of the day. And sometimes it takes on different sort of frames. So now, I would argue that the health equity conversation is sort of talked about in social determinants. That's the new sort of synonym that's being used. And I think it's sort of, you got to be there every day pushing it. It's not always good. You may be the only lone voice. People be like, why are you coming to talk to me about this issue again? But you sort of have to keep tilling the soil until the day comes that the opportunity opens up. And people, and now I think as a country, the shifting of our demographic, even if we don't want to do it, is going to inherently make us address equity issues. Because if you don't, our healthcare costs are going to skyrocket. If you look at who gets the burden of diabetes, who gets the burden of heart disease, we can't afford the majority of our population, because we'll be majority minority, to be burdened by these conditions. It's the same with it's across education. And so the time is coming, whether we want to or not, that this is going to be central to government and policy making, our federal budget, our state budget. So.
I would definitely echo both Waverly and Josh's points to trying lots of things out as a student, so and to being involved in student organizations. I was I think in the medical school, the American Medical Students Association and the Student National Medical Association both did trips to the Hill, which was a great chance to understand more about messaging around particular issues and the particular role that physicians have as also as a national leader in the Student National Medical Association. We always participated in the Congressional Black Caucus weekend. I think at one point I testified to a joint committee of the CBC and the Congressional Hispanic Caucus around representation of underrepresented minorities in medicine, and it was like aligned with what I had decided was going to be my platform as the president for that year, and it was related to the dissertation research I was doing on patient-provider communication and race concordance or similar characteristics shared between physicians and patients with Dr. Cooper, and I also did a march around, because this was when the cases from University of Michigan had made their way to the Supreme Court, and so we allied with leaders of Black student organizations and minority student organizations across disciplines, engineering, dentistry, business, and we all marched as part of a march that was taking place during the time of those Supreme Court hearings. That definitely was not my style. I got a little bit worried about, was I going to be on some FBI list from some of the listservs I got attached to during that time, but it all worked out fine. And then also had opportunities to go with a congressional delegation to Cuba during that period, and decided that I would create a course for SNMA students to go to Cuba to learn about alternative healthcare delivery systems and the impact of community health approaches on addressing health, particularly in under-resourced populations, but thinking about how those same types of sort of low-tech strategies might apply to disparately underserved populations in the U.S. And it was so much fun. Also very different. Also got a little worried whether I was going to be on some strange list for having gone to Cuba twice, but again, it all worked out just fine. Everything was endorsed by the federal government and signed and, official. And I think those kind of stretch opportunities really push you to say, what's really me and where do I feel most comfortable finding my voice, and where do I need to be courageous and stretch if I really care about a particular issue or population. And then in residency, it was interning at the American Academy of Pediatrics in their Federal Affairs office, and getting a chance. And also, I shouldn't admit to this, but while I was writing my dissertation, I was always finding reasons to attend a variety of interesting hearings on the Hill around different topics relevant to the African diaspora that may or may not have been directly related to health, but I think for me were directly related to social determinants, social status, marginalized status, and the impact that has on health and well-being from a broad frame. And that was all part of my education. That was just something that I was feeling pulled and called to stay engaged in. And that's not really a luxury you have at other times, except if you decide to apply to a policy fellowship at some point in your professional career, which I also did and I also highly recommend. And it is another chance to indulge, again, a little bit more in that experiential aspect of engaging in policymaking. And understand better all the different types of policymaking and policymakers beyond the legislators, who are incredibly important, but I think are just one piece in this really big and complicated puzzle. So that's my long-winded way of saying I agree with Waverly and Josh and giving you some other examples of ways you can do that self-exploration.
Great. And as we are exploring our final theme, I invite you to come to one of the two mics if you have any burning questions that we can address in the final few minutes of the discussion before we migrate over to the reception. But so our final and perhaps most important thing is related to giving voice to individuals who are impacted by health inequities and or by these policies that may disproportionately impact certain groups. So, Deidra, I know you've done a lot of work that, also has involved inviting some of the DDP scholars to come with you and other patients. So, would you all just talk about, I guess, the best way to use your positions of power or your seat at the table to then really invite the others that you're hoping to represent to also come and be champions for their own areas of interest and expertise. So,
yeah, so happy to share that. So, I think there's a few different ways. But it really boiled down to kind of you being a person who can tell the stories of the people that you are fortunate to work with and to engage with, who have been impacted by health inequities. And then also taking those people with you when you go to engage with policymakers. So as Tanjala said, I've had, I think, kind of two different opportunities around this. One, as I mentioned, through my subspecialty organization, where we have, each year we have an advocacy day where we're really focused on health policies, and then a separate day where we're focused on kind of the research agenda of our organization and going and actually kind of meeting with different grant-making groups like the NIH or PCORI and other agencies. And what we do is we actually take patients with us, people with kidney diseases, and actually, while we may provide kind of that the sort of expert background on the condition and provide some of the facts around how many people are affected, and we do try to provide sort of succinct information, usually just kind of a one-pager with the key points. And when we're meeting with different congressional offices, we try to provide them with local data as best that we can. Like sort of if we're visiting with representatives from the state of Connecticut, we're giving them information about Connecticut. Even bonus if we have members of our organization who are from the state of Connecticut, they love to have you sign their book and take a picture next to the flag and all that for the state. So that's been really important. Bringing the patients with us to after we've kind of provided that background, having a patient or two with us in the room who can actually really personalize these issues. One of the recent issues that we were kind of advocating for was the Living Donor Protection Act. I know there's many interested in this topic in this room, a few anyway, who work in this area, but which is a sort of for people who are considering becoming living donors, one of the challenges is one of the main barriers, or there are actually many financial barriers to being a living donor. And this particular act would basically protect donors from kind of being discriminated against for certain types of insurance coverage and the like. And so we brought with us a person who had received a kidney from a living donor to sort of tell kind of what that was like and the impact that process had on their donor, and also how important it was for them as the recipient to have that donor be able to actually give them a kidney. And so that was important to have them there in the room. And then, as Tanjala mentioned, so I am fortunate to direct a program called the Doctoral Diversity Program, which we have many of our scholars here today, which is a post-baccalaureate program. It's a pipeline program to increase diversity of individuals who are in the biomedical fields, but both going into medical school as well as into programs where they're receiving their PhDs. And programs like it have been slated to have their funding cut from the federal budget. And so over the last year and a half, we've taken a few trips down to the Hill and have taken some of the scholars from our program with us, again, to sort of advocate for continued funding for these types of programs, demonstrating their importance in our work towards trying to achieve health equity. We think, and it's been well documented, that having a diverse workforce is a key component of any efforts to address health disparities. And so again, while myself and my colleague, Doug Robinson, who's the kind of overarching director of our pipeline initiative, while we'll tell sort of the facts and figures and, you know, how much does it cost to run the program and to support the students, having some of our actual scholars there with us to tell the stories has been really invaluable. We had I don't see the particular scholar I was going to talk about, Ricardo, who the last time we went to the Hill, Congressman Anthony Brown actually met with us directly. He has a small staff, I think, being a new congressman, but he ended up meeting with us directly. And as it turns out, so Ricardo, who's one of our scholars, his family's originally from Cuba, and as it turns out, Congressman Brown's father immigrated here from Cuba. And they actually engaged in a discussion that there wasn't a dry eye in the room when speaking about this, because it turns out Congressman Brown's father was a physician. And he shared with us how how much of a privilege being a physician was for him. And Congressman Brown remembered these sort of stories that his father would tell. And so by the end of the meeting, he turned to his staffer and said, you know, let's draft a letter, you know, supporting programs like this. Tell us what kind of language we need to use. And so that was I think one example of how bringing the actual people that these policies affect can be really, really impactful.
Awesome.
I was just going to say, I think sometimes also knowing who the advocates are in a particular area where you're producing scholarship can be an avenue for ensuring that the scholarly findings of your research are deployable by those entities. So whether that's through foundations that work in a particular area and may be interested in a white paper or a report on a topic related to your research, or fact sheets. Or one example for us was working with a local network of neighborhood associations. And identifying elements of the work we were doing locally that would be valuable information for them to use, and engaging with community organizers and others. And then, you have to let go of the scholarship at that point and then let someone else be in control of how it's used. But understanding those, forging and developing those relationships, understanding those players and what they're really advocating for, and ensuring that you're deploying those resources to organizations that you think are approaching an issue from a similar perspective to the perspective that you think would be advisable based on the research you've done is important. And then another example, which is a little bit farther from prime time, but just to encourage everyone in their research pursuits, particularly those who might be doing qualitative work or who are working on topics that have a lot of policy implications. And I see a couple people from CCHR just made me think of this in some work we've done recently around cyclic variation in food availability in the homes of people who are in poverty and who are utilizing federal nutrition assistance benefits. We've been explicit in kind of saying, obviously this research is not likely to have a direct effect on you in a positive way, but this is research that we hope will inform policymaking in the future around benefit disbursement. When there are instances where your research is responsive to a particular type of policy and could inform how that policy is implemented, I think it's helpful to make that connection for people so they understand what the importance of their contributions. And we've found that, our participants in in-depth interviews will be like, and when you're writing this up, just tell them about this change they made and the timing of my benefits, and it's really messed up my ability to access sales, or just people need to know this isn't enough, and I think sometimes just being able to let people know that their experience and their perspective is valuable and may potentially inform the direction that policy goes in the future is a powerful way to engage with people who often feel marginalized and voiceless. And then it's our responsibility to really have integrity when we're done processing everything and ensure that some of that human element is maintained and communicated. I think that's just something that is a constant part of what we do, and is a particular value of being engaged with the people that we're and the communities that we're interested in understanding better through research. And it's a particular type of research, whether it's CBPR specifically or just somewhere on the spectrum of that human engagement with participants. I think it's important to remember that gives meaning to people's lives to be able to share, and then we have a responsibility to have integrity when we're communicating their perceptions to policymakers and when we're thinking about how we do that.
I guess to launch from there, for your research, I think the big thing sort of to think about how to give people a voice is how to use your position to give them a voice. Like, you all will leave here and be leaders in your community, whatever field you choose to do. And you will have the opportunity to sit on boards, you'll have the opportunity to play in conferences, you'll have the opportunity to take people to the Hill, and you get to decide how that looks. Like, you will be empowered to say, oh, I want to bring people this effects with me, even if it's just 1 or 2 patients. Like, that's huge to incorporate them into whatever you're doing. Because at the core of policymaking really is storytelling. I mean, like, if you think of any big healthcare issue, and you think of the articles, and you think of the messaging, what did it all start with? Sally had this, and Sally's about to lose her insurance. That means her diabetes is going to be unregulated. And, or Sally had a heart attack. Thank God she had insurance. Or, Sally got a job, and therefore, she got insurance, and therefore, she didn't really need it. So, all those, it's the center of sort of what we do. It's sort of the center of how we talk. It's what people engage. I mean, even the opioid epidemic. You get into a conversation, inevitably someone is going to say, my neighbor's son is battling opioid addiction. I mean, that's why every member of Congress is talking about it. It's not just because of the numbers. It's all the articles. Like, you open up a paper in America across the country, there's an article about somebody who's lost, whose life was lost too soon because of the opioid epidemic. Like, it moved, we're at the center of policymaking is still people. It's just making them care about the people that you care about and the issues that you care about. I think another way to your research point, so to the evidence-based question, evidence-based policymaking, I think, is the gold standard. It's what we do, it's what we aim to do, but there are weaknesses to it. There are real weaknesses. Evidence is only created to the degree that people are researching it and to the degree that someone's funding it, such that, there are things and there are populations. So, for example, Native Americans, there aren't many people doing research on Native Americans. And they have unique challenges in health and education, particularly those who live in reservations, that will be very different than, they were living in Baltimore. The same way if you live in Baltimore, you'd have unique challenges, but no one's studying them. So, there really aren't a lot of evidence-based approaches that are culturally competent to deal with Indians. Should that mean we shouldn't make policy? It's sort of like a push and pull. And so that's why we also need a lot of people to do research in health equity, so that there is more evidence out there. We need people to apply to NIH and the other funding agencies, so there is more robust evidence that we know more about these individuals. We need people to encourage people to participate in research, be it clinical trials, be it the Precision Medicine Initiative, so that their voices and their data is captured into these different models that we're using on things. And so I think the big thing is sort of think of how you can engage them through your role, be it your organization bringing them along, because they're used. I mean, there are patient groups for every kind of condition you can think of, and whenever the issue come up, let's say we change insurance policy, they will come up, and say this is what you need to be changed. And so I think it's sort of thinking of ways to just incorporate them and bring them along, sort of as you all said, to piggyback on the data, because they're the face of it. I mean, for many members, like, that's what's going to pull their heartstring. Like that conversation you talked about with Mr. Brown, like, that would be memorable. I'm sure it's more memorable than any bullet point you put on a sheet of paper, you know, to sort of say, you know, X number of people are affected. Like, that's really, I mean, at the end of the day, these are people. You know, these are people that get up and read the news and, you know, watch the news or hear from their neighbors or hear from a constituent, and they're like, we need to solve this problem. I mean, it happens literally every day that a member comes in and says, I read this article last night. I want you to figure out what's going on with this, and is there a way we can solve it? Like, so you have to think of opportunities like that, I think, to get people to sort of to engage people who are most affected by these conditions.
I want to tell just one story, quick story, because I agree that the story piece is so important. One of the things, so some of you may know that, end-stage renal disease, and I hate to be on message, but I am a nephrologist, so you'll forgive me, but that, you know, it's the only chronic condition that gets people automatically eligible for Medicare without being 65 or over. And the reason is because of the story really around this, in that in 1972, a patient was actually wheeled into the floor of Congress and dialyzed in front of the members there, and, you know, so that they could see, you know, what it is that people on dialysis actually go through. And shortly thereafter, legislation was introduced to actually cover this care for people with kidney failure. So it's a very powerful. And stories are so powerful, and so to the extent that we can continue to kind of share the stories to promote health equity, I think it's so important.
And then to the pipeline point, I think that's also a big thing. Like, being in the room and bringing your perspective is a lot of times the biggest effect you can ever have. Because if you're not there, your perspective won't be there. I mean, like, most rooms I walk in, even to this day, I'm probably the only African American, and then I would say African American female sitting in a room talking about healthcare. I mean, like, we're not talking about health disparities. I mean, it's sort of funny. When I first came to the Hill as a fellow, I worked for Donna Christensen, who her big issue was health disparities. I would go to conferences, people would come meet with her. I would see all these diverse people. You know, people were like African Americans. There were people from like the Caribbean. There were, you know, different Hispanics people would come in, and, you know, you'd hear all these different voices, and I'd be like, okay, yeah, this is cool, you know, like. And then, you know, I left her office and ended up going to a committee, not the committee I'm on now. And it's literally like, it's a different world. It's like, man, like, do minority advocates even exist? I mean, it's on a given day, on a given month, I may not see but maybe one minority that's an advocate, be it a lobbyist, be it somebody advocating for a position, be it another, you know, be it a staffer. And so that is a part, I think, of bringing our stories and our experiences and the things we care about, is simply by being there, and then when you're there, to talk about it. Like, just don't be, you know, bump on a log and go along. Like, you know, like, we are blessed with opportunity a lot of times to sort of bring that to the table where others can't. So I definitely appreciate your pipeline, your points about like these pipeline programs. I think it's very critical.
Wonderful. So I think that was a great way to end our discussion and segue to our reception. But thank you again to our fantastic panelists.